Well, we want to go ahead and open up a new note for this particular test patient, Randy test. And so we've gotten into his file, and you'll see here all of the different dates of service for which there are records for this particular test patient. Okay, so we could go ahead and open up a record, and you'll see that there's like an active link. We can just double click on that particular visit, and that will open up that particular record. Now, this note is unsigned, and so we could go ahead and make changes in this note. However, if we were to go ahead and click on a signed note, such as this one here, we will be unable to make any changes into that particular note, and you'll see everything is grayed out, but it will allow us to view the note. Now we can go ahead and amend this note simply by going down to the bottom of the screen, click on amend, and then electronically signing in if you are that provider. Click OK, and then it will allow you the opportunity to go ahead and make any changes into the note that you would like. Once those changes have been made, such as let's go ahead and make one. There, we added something to the subjective here. We're going to add a little bit more. We're going to say that we did COVID screening, negative, and let's just say that, hey, we forgot to mark what visit number this is. This is 2, and let's say it's out of 10. And there we go. All right, so we're going to go ahead and save and close. Now that note is currently unsigned, and so because it has been amended, and so what we're going to do is go ahead and sign it. So you'll see that the note has been and does show that it has been amended. And when we go to open that note up again, of course, it has not been signed yet. It is currently in the amendment stage, if you will. But you'll see right here that it was amended by James Smith on that date at that time. Then we get into the subjective area that we made the changes. You'll see those changes there, what was made. And keep in mind too that this also does produce a red line version. So we're going to go ahead and sign this amended note. We're going to click on sign, and this pop-up can be designed to remind you that maybe there are certain elements that have not been completed. And so you can either just go ahead and bypass that and click through it, or you can go back and make sure that you did complete it. And so we've signed the note. It is done being signed. And you'll see again that it's all grayed out now again. And we'll just go ahead and save and close. So we've opened up that patient file. Here are all the patient's records within the file on that particular office visit. Now, if we want to view the other documents that could be within this patient's file, you'll see documentation list, and then it's signifying that this is the office visit notes. And so we're going to go ahead and just click on this triple line here, and you'll see that it opens up all of the different sections that are available, or list of documents that are available. And let's say that we wanted to view all of the patient letters that have been generated for this patient. Here they are. You can open them up. You can see that either they're signed or unsigned or amended. And then any other types of records that are being kept within the patient file, they can be labeled and sorted to your liking. So we'll go ahead and close that. Actually, we're going to go ahead and go back to office visit, because this is where the patient record for treatment is. And so let's go ahead and open up a new patient record to begin to document treatment. And so we'll come up to this group of icons here, and you'll see the plus sign. That means that we're going to go ahead and add a new note. It will open up a window or a screen that will allow us to complete and choose what case that we're working on. So if there are a number of cases that could be individual payer groups that are responsible for the treatment that's being provided, that would be selected there. The date of the note, you can go backwards in your date, but you can't date forward. And of course, it will automatically choose the time as it is. Provider default to yourself or other providers. And then if there is a co-signatory that could be involved, and then your location that you're in of where you are delivering the service. And since that all is pretty much at a default there, we're going to go ahead and click OK. And then that brings us into our record. And you'll see on the left-hand side of the screen, this is somewhat of our checklist of all the things that we need to think about when we document a patient record. And this checklist, you can see, is fairly long, and it has several different sections that you'll be very familiar with. First one that we'll cover will be visit type, and that will help us know what type of visit this is, visit number per the plan within a treatment plan, history of present illness, and then of course subjective outcome assessments, past family medical social history, review of systems, documenting current meds or allergies, subjective, which helps identify and detail the chief complaints, and then of course our objective findings, including our vitals, exam, functional and balance assessment, testing, diagnostic orders, radiology report, and then to be able to bring in images or take images, both video and still, that can be recorded within the patient record. Then we move into our assessment, where we would be identifying the problem diagnosis, provider referral or response to referral, and then the treatment plan. And of course, that could include a plan of care either from medical personnel, chiropractic, physical therapy, any DME prescribed would all fall within the realm of a treatment plan, and procedures per provider type as well, and types of procedures. And then finally, we have our charge capture, which it all comes together, the problem diagnosis, and the CPT codes that are dropped into charge capture from documenting in the procedure section. It is automatically baked into the documentation of these procedures and will drop in, and then you simply link the diagnosis codes to the CPT code and then able to move that on, sign the note, and it moves into the billing section and creates a claim. And so that's just a general overview of the note. Now within this system, the iPatient Care system, this is completely customizable. And so it's like starting with a blank whiteboard. And what we have done is we've purposefully put in the thought process of working with multidisciplinary clients and solo practitioners to be able to come up with a system that can be even further customized and tailored for your practice. So let's understand visit types within the iPatient Care system. And so we've got a patient record that's open, and you'll see on the left-hand side of the screen, visit type. We're going to simply select visit type. And what that is going to do is open up a group of options for us to be able to do two things to this note. Number one, it helps us identify the purpose of the visit. And so the purpose of the visit could be that this is an initial evaluation for an auto accident, or maybe a general physical exam, or maybe there's a chief complaint like headache, or maybe it's a specific provider treatment visit. This can be customized to the type of visit that you would like to be able to identify on the record itself. Secondly, what it does is that in the event that you choose an auto accident initial visit as an example, then within the history of present illness, and we'll go there next, it can bring in specific questions for that type of a visit or chief complaint. So you'll see when we selected auto accident initial visit, it brought in a list of items that are important within a history of present illness, including specific auto accident history questions that you would collect from your patient and document into the patient's record. Now, as we work through this in the history of present illness, as an example, you can see that we recommend, beginning at the top, that complaint location. Where is the patient having difficulty? Auto accident history, having that completed and simply moving from left to right. So date of the motor vehicle accident, selecting the date on the calendar, the time of the motor vehicle accident, and you can select the time. Were they unconscious at impact? Does the patient recall details of the accident? Yes, they do. Is recollection foggy? Yes. So on and so forth. And then this begins to build out that history for that particular patient. And then moving on down to the next thing, providers seen since the motor vehicle accident. Well, there weren't any. Diagnostic tests after the MVA. Well, they had x-rays taken over the neck and mid-back at, let's say, a local hospital. Have they missed any work, missed any school? If so, how many days have been missed of school? We'll say 2 days. Any self-care remedies? Yes. And the patient tried ice and heat. Any prior complaints? Maybe denial of any similar complaints in the past. Any prior treatment? No prior treatment. Any prior diagnostic tests prior to the accident, and we'll just state no prior imaging. So that completes the history of present illness for this particular patient for that specific visit type. And so you'll see that the system, as we've talked about, works from top down and left to right, and it allows you that opportunity to sequentially, meet the needs of all the requirements of that particular aspect of the note, and in this case, the history of present illness. Likewise, documenting the past family medical social history, simply selecting that section opens up the family history, and this is where you can document any family history that is notable, any past medical history of the patient. Maybe they have a surgical history of shoulder surgery and knee surgery, or whatever the details are of that. All throughout the records, you will see free text, and when you select that, then you can type in anything that you would like to have within the record to be able to document even more thoroughly what we need to document to make this encounter specific to the patient's visit. Next, we have the social history and, of course, their marital status. How many children are at home? How many children are away? What is the patient's occupation? And so on and so forth. Their smoking status, alcohol use. And then, of course, then we move on to the review of systems. And the review of systems is taken from the patient on an intake. And this is where you can simply select, by just clicking the plus sign, what the patient has recognized and provided you as feedback on the review of systems form. Review of systems form. Documenting current medications that the patient may have. So when we work in this particular section, It allows us the chance to be able to add new medications to the list by searching the medication that are available. And you'll see there, just by simply typing in, it allows us the chance to go ahead and make the selection that is the most appropriate for the patient. And just select next. And that brings you into this particular window where you can complete even more information about the patient's medication details. Allergy documentation. Is completed along the same lines, where you can search for specific allergies, whether they're food, allergy driven, drug reaction, adverse drug reaction driven. Documenting the chief complaints is performed in the subjective section. So when we select subjective, that brings open a number of chief complaints that we have available: headache, neck, mid-back, low back, pelvis, upper extremity, lower extremity, and then we'll talk about functional activity limitations. Very first, right off the get-go, we have COVID screening, documenting that there was a negative screening, and then documenting what visit this is out of the total number of the treatment plan visits. Next, we'll go ahead and select our chief complaint. So let's say that patient is in with neck pain as a chief complaint. Patient is having right-sided neck pain. It's radiating into the right arm, to the right elbow. Current pain intensity on a 0 to 10 is at a 7. The current pain frequency is constant. And we've got pain quality factors of aching and burning and dull pain, sharp and radiating. And the pain is aggravated by breathing and carrying and coughing, and it is relieved by ice. And it is getting worse. And so that documents the elements, historical elements that are needed to properly document that particular chief complaint. Then we can move on to the next chief complaint. And let's say that it's low back, and it happens to be the right side of the low back. There's no radiation, but we have a current intensity of 3, current pain frequency of intermittent. The quality pain factors is that it's dull, aggravated by bending forward, and also lifting. And then what is the pain relieved by? We'll say heat, and this is staying the same. And so there we have our chief complaints of neck and low back pain documented. And then finally, to complete the documentation from a musculoskeletal perspective, is to move on down to the functional activity limitations. Now, this is just as important as documenting the pain and all those other factors regarding pain and where it's located, but also then what are the particular activities that are limited because of that. And so this is where we would document those functional activity limitations. And so we would go ahead and specifically select what activity is being restricted by the patient. And let's say sitting is being restricted by the patient. Today's limitation is actually that the patient can only sit for 10 minutes. And so we have that documented, and it is getting worse. And of course, we're talking about an initial visit here, and so we don't have anything to go on previous to that. And let's say that we've got functional activity of lifting. As we said, the patient has low back pain. That limitation today, in terms of number of pounds, is 10 pounds. And so we've established that as limiting factors for the patient in addition to their chief complaints. Now, this becomes an important factor, especially as you document subsequent visits, because you're documenting changes since the last visit, and we'll talk more about that in a subsequent module. Moving on to objective findings. So when we select objective, this is where palpatory findings can be documented by the chiropractic physician and physical therapist. And so spinal subluxation, simply selecting the region and the levels of the spinal subluxation. And then, of course, any paraspinal changes, whether it's tenderness or hypertonicity or trigger points or edema that's involved, this can be documented appropriately at this level, helping to validate a subluxation is present in that particular region based on Medicare documentation guidelines. And of course, each region is represented along with extremity, upper extremity, lower extremity, rib subluxation, and of course, cranial subluxation, and then other palpatory findings that involve the muscle groups within those particular regions. Moving on down below objective, we have vitals. Vitals give us a good indication as what's going on with the patient's body systems, and simply opening up a new vital section and then documenting what is the temp, what is the pulse rate, what is the respiration rate, where it was taken, temporal is the default, was the patient's pulse regular, irregular, was the breathing rate normal or labored, then blood pressure systolic over diastolic, was that standing, sitting, or supine, left or right. And then, of course, height, weight, and then the BMI would automatically be calculated. And then saving these vitals so that you have documented history of the patient's vitals over a period of time. Then we move on down to examination. And you'll notice that we move, again, top down, left to right. And so we are working our way through, on the left-hand side of the screen here, our note to make sure that we cover everything that we need to cover on this particular visit, which, again, is an initial visit evaluation. And so we're finally into the exam area, and here's where we can document the postural evaluation, our observation of the patient, the neurological exam of the patient. Let's say, for instance, the deep tendon reflexes, and being able to document what level that they are measured at. Same with the motor exam. What level would they be measured at on a motor 0 to 5 scale? Dermatomes, mensuration, pathological reflexes, cranial nerve exam, our concussion findings, and then, of course, Reber or Rene test. Orthopedic exam. You'll see the range of motion can be documented accordingly, and then also be able to describe any type of common features that go along with that, or to free text them in, as we do have free text box available. And then we also have built in likelihood ratios based on the literature that will help validate a specific diagnosis that you are either ruling in or ruling out in your evaluation process. And so you'll see here, as an example, nerve root compression tests consist of Sperling's compression, cervical distraction, upper limb tension, and cervical spine rotation less than 60 degrees. When these are positive, and especially when there is 2 or more positive, then the likelihood of nerve root compression is high. And then finally, we have a number of other orthopedic tests that are available, as well as any other tests that you would deem that you would like to have built into the system. It is easily customizable. Now, just to demonstrate how customizable this is, we're going to go ahead and go into the back room. We're going to do that by coming right up to this little icon here and the personalize button. We're going to select that. And here we are. We're right in the back room. It's just that easy. And what's important for us is to help you understand exactly how to go ahead and create these changes within the system, and then you can customize this as time goes on. We will always be here to help you, but this system is very easy to be able to customize, personalize to your liking, so you can add tests, take tests out, maybe change verbiage. Anything that you would like to do, you can customize that. And so as we've talked about the exam, working our way down, orthopedic exam, general health exam, all of this, again, within the examination section. Then we built out a couple of scoring forms, functional assessment being one. And this is an area where you would be looking to document your physical performance testing and measurement prior to a rehab treatment plan. And so this is just an example of a physical performance test that we have already in the system. You may have one that you already have developed that can go ahead and be customized into this format. In addition to functional assessment, there's the balance assessment, and we have a number of balance assessment tools that are already built into the system, readily available for you to go ahead and use. So for instance, we've got the ABC test, and we'll go ahead and scroll down, allow it a chance to go ahead and load the next one. And then that brings the next test up, which is fall screening balance error scoring. And we'll just Tenetti's balance assessment, risk assessment, and a number of other tests that we have available already in the system. And so whatever is not in the system currently can be added to the system. Next, we have diagnostic orders. And so this is where you would be documenting what orders that you need. This would be where you would be documenting your diagnostic orders, such as X-ray or any other advanced imaging that you are either performing in-house or making a referral to complete. And when this is selected in the diagnostic order section, it automatically documents it into the record, as well as documents it in charge capture, ready for billing. Your radiology report is a section that is fairly detailed out, and as you work with it, you'll see that it is laid out based on radiographic interpretation guidelines, as well as specific measurements and findings that are typical within that particular region for bone, for cartilage, for alignment, for bone, for cartilage, for alignment, for bone, for cartilage, and soft tissue, in addition to stress tests. And then we have the image and the video clip sections. And this is where you can bring in X-ray images for review, as well as allowing them to be dropped into the patient record for the date of service. So the image section is where you can bring in images. So you can have an image of a radio, you can have the image of a radiograph, which you see here. Or you can bring in an image that you may want to go ahead and mark on or annotate. And this can be added into the patient record and write directly into the patient note.